Welcome back to the program as we continue on tonight's special episode of First Issues, where we're discussing COVID-19 frequently asked questions with Dr. Kiran Bhagat. On this segment, we asked the doctor if children under the age of 15 should be getting vaccinated, and if there are any specific concerns for getting kids vaccinated.
The issue of vaccinating children for the sake of the child's health is now increasingly an important issue with the rise of what is called the Delta variant. The Delta variant seems to be a virus that is much easily transmitted, it's more infectious, and we're beginning to see children being infected by it and having to be admitted into hospital, whether it's for a flu-like illness, whether it's in rare situations. Remember, the virus not only attacks the lungs. People assume that it's just a lung infection, but the virus has been found in the heart, it's been found in the brain, it's been found in the kidneys, it's been found in the muscles. And so children, for reasons we're not sure, may develop what's called a myocarditis, an inflammation of the heart. Some teenagers have developed strokes, others have developed kidney failure, or chest infections that take a long time to recover. In addition, we're beginning to see in children who've had initially COVID without any symptoms develop what we've discussed before, called the long COVID syndrome, where after the COVID infection, the inflammation in the body seems to impact the child in other ways: depression, anxiety, brain fog, memory loss, fatigue, muscle cramps, abnormal rhythms in the heart. And we're seeing this in the teenage and the younger population. So there is a call internationally to vaccinate children. We will have data, according to the international scientists, in children above the age of 2 soon that are being studied. Just like we vaccinate for measles, mumps and rubella, this may be part of the cocktail that we give to children in prevention of other conditions.
With all of that, are there any specific concerns to children getting vaccinated for this disease?
That's a good question, and the concerns that we have are in a small percentage of situations, particularly with the vaccine called Pfizer. Some number of children have developed an inflammation of the heart called a myocarditis, and it must be said that the majority were mild and recovered very quickly. But as with the anti-vaccine lobby and those that are resistant to or hesitant to take the vaccine, they pick out these particular studies and say, well, this is why it's dangerous in children. I think, these are really small issues compared to the larger issue of children being allowed, to be children at school in the safety of the knowledge that they're being vaccinated. So the side effects of the vaccine are pretty much like the adults. You get a sore arm, maybe a light fever and a feeling of fatigue for 24 hours, much shorter in children. And beyond that, no major studies have reported any side effects in children over the age of 12 by getting the vaccination.
Children have gone back to school now after a very short hiatus. Does that increase their chances of catching and transmitting the coronavirus?
This is the issue and the call by the public health specialists to vaccinate children, that those children who are vaccinated are much less likely to spread the virus to other children, because we've had the situation where children have had COVID before and have overcome it, been quarantined, are now resistant, but may still carry the virus and transmit it to children who are not infected. Those children will then take it to the bigger community, whether it's home or to other adults. And so there will be a vertical rise in terms of the adults that are affected by children who are having COVID, because the majority of children who have COVID are without symptoms. So the issue also, Ponanseko, is that in terms of the vaccine story, remember that the majority of children probably have already had COVID, and we don't know it. We don't know the percentage of children, because they've been playing and then touching each other, and it may have just been written off as a flu-like illness, because we don't test every child. And so majority of children may well be already immune to it, but will carry the virus and infect others, and particularly adults and elderly who are not yet vaccinated. So this issue is an issue that is currently debated internationally, and I think by bigger organs like the WHO.
In a closing segment of tonight's installment of First Issues, we will be discussing exactly how this pandemic has affected the pediatric population and school-going youth. That shortly after the break.